Hello, my name is Olowu, and we're here talking to Dr. Olowu, one of our favorite doctors here on Health Boxes, to talk a little bit more about anemia. The reason why it's close to my heart is because I've suffered from anemia almost all my adult life. Why not come with us on this journey to be able to learn a bit more? Welcome, Dr. Anne. How are you doing today?
Fine. And just as you said that you suffered from anemia most of your adult life, I have. Ironically as well, I have as well. It's good that we're talking about
it. Raising awareness. It's not a death sentence. You can still live fulfilled life even if you're having low blood iron. Let us understand a little bit of anemia. What exactly is it?
And then before I describe what anemia is, and a lot of people actually are anemic and they don't know. So we have a lot of people walking around, children, adults, who are anemic and don't even know. So what is anemia? Anemia is when you have low red blood cells, and we know that hemoglobin and red blood cells are needed for the circulation of oxygen all through the body. Yeah. Anemia really is just when there are not enough red blood cells in circulation in the body.
Why then do you feel tired when there isn't enough red blood cells?
Think about what the red blood cell does, as we mentioned before, that it carries oxygen all over. And so as blood is circulating, it's circulating oxygen in and carbon dioxide out through all of the whole process that the body does. And so if enough oxygen is not getting all through the body cells, all the cells of the body are not well oxygenated, then you can imagine why, you can then understand why you get easily tired and easily fatigued. Or now we're talking about some of the symptoms, especially when on exertion, maybe you've done some rigorous work or physical activity, it even worsens because then you are needing more oxygen and your body is not circulating enough oxygen because you don't have enough red blood cells, and so you get easily tired.
So the oxygen goes where? Because I know,
yes,
but maybe somebody that didn't do biology, for example.
All of the cells. So we know that the unit of the body is the cell.
Yes,
our cells. So all of your cells, as the oxygen gets attached to your blood vessels, to your blood cells, to the hemoglobin in your blood cells, it permeates to every single cell. The cells in our brain, the cells in our liver, the cells in our kidneys, our muscles, everywhere.
Is it only women that get it? Is it only women and children? Why do men get anemia? Why are women more successful?
Everyone is at risk of having anemia. And maybe we should just talk a little about the different types of anemia that we have.
Yes. So
because we have different types of anemia, and both men and women, children, adults can suffer from one type of anemia or the other. However, I think that the one that we are really focusing our conversation on is iron deficiency anemia, because that is quite common, and there are different there are different causes and causations for iron deficiency anemia. But having said that, we also have things like aplastic anemia. We have microcytic anemia, different types of anemia.
And we're not going into that.
So we're sticking more to iron deficiency anemia, which is relatively common and which affects both children, adults, men, and women.
So what role does iron play in this anemia?
Because iron helps in the attacking that process that helps to take blood around the body to.
So it's essentially if obviously you don't have a carrier, then it becomes very difficult for you to read. So what symptoms should people be looking out for if they think that they might want to investigate further?
For most people, it's the fact that they find that they are easily tired. They get tired easily, they are fatigued easily from things that would normally, from chores or normal day activities that would not tire them out. Sometimes people can even wake up tired. So tiredness is a very common symptom or sign of anemia. But we'll have other things. We have things like headaches. We have, like I said, dizziness upon exertion, or lightheadedness upon exertion, or even from trying to stand up from a sitting position. There's also that dizziness that can happen when anemia has set in. And then we also have other symptoms like brittle head, brittle nails, for prolonged anemia. We have palpitation. Palpitation is when you feel your heart beating, and that's because the heart is doing more work than it should. Because the body is requiring more oxygen, and the heart is needing to pump a lot more than it would usually do if there were no anemia. And then we have symptoms, other symptoms like cravings for ice. You know,
I had that. No, actually, mine wasn't ice. Mine was yes. I would wake up in the middle of the night. Then I was working in the UK. I would wake up and I would drive to the nearest petrol station, because there petrol stations were open 24/7, and there was always a kiosk there. And I would just buy this XXL mint. I used to finish a pack of 5. I don't know, within 30 minutes or less.
It's ridiculous. I don't know we don't. Science hasn't been able to explain that
Why the craving?
Yes, for me it was ice.
Yeah.
I would crave. I took so much ice that I felt it began to affect my esophagus. I felt that it was beginning to change the cell formation, and that really concerned me.
Mine affected my teeth.
And I really tried as much as possible to what's it called now, to break the habit. So I read books on how to curtail that, and I would succeed, and it will come back, and then I'll stop taking ice. I'll look for other alternatives. I'll do popsicles. I'm like, no, I just you know what? Let me just check my iron levels. You know that you have anemia, but you don't. At a point, I thought it was more of a habit thing that I needed to break. I thought it was a hole that it had in me that I needed to break.
Yeah.
It didn't occur to me that anemia can drive you so into ice cravings in that way. And the instant I started taking medication for anemia,
It died.
it died.
Yes, same
The
here.
ice cream, that's how
I think it was probably the sugar in the mints, because those XXL mints were really, and it's literally just sugar. So maybe it was giving me energy boosts.
I see.
Yeah.
There's that possibility, isn't it?
I think that was what it was.
For some people, it's this clay thing. You know, there's this thing they call, I don't know the name in Igbo, that some people eat. It's like ash. So they eat it as well. So if you have that issue, it's not a habit thing that you need to break. Once you just get treated for anemia, you will find that it disappears. And there are some other things as well. We have cold feet, cold hands. This is when the anemia is really now bad, becoming chronic.
Yeah.
So you have all of those things. And beyond that, it also goes on to affect the heart.
Yeah.
So some of the signs, like the enlargement of the heart. It's important that you get treatment.
Yes. So why would it affect enlargement of the heart? Why? It's like an overcompensation.
Yes.
And since the heart is a muscle anyway, it's getting bigger. What would it? You mentioned some of the symptoms.
We didn't talk about what causes.
Yes.
The causes of anemia.
Causes of anemia.
Now there are different causes. We'll talk about each of them to some degree. Number one, dietary causes. And that's why we see that anemia affects children. Children between 6 months to 59 months or 5 years of age. And the main cause of that is from diet. And having poor iron diets, poor diets that are not rich in iron would lead to dietary deficiency.
Based on the Nigerian diet now, would you say that a lot of our foods?
We have a lot of our foods have iron. We have dark green vegetables. We have ugu. That's spinach. No, that's not. That's the pumpkin. Then we have spinach. We have the very dark ones, because there are different varieties. We have the very dark ones. We have a lot of dark.
But if you don't have your children that tell you that they don't like,
we have iron in meat. We have them in fish.
We have them in nuts as well.
We have them in nuts.
Yes.
We have.
I think avocado.
Well, I know that we have a diet that is rich in iron, so that would not be a problem, both for adults and children. And we find that in environments where the economic ability is low, you also find that a lot of children who are young suffer from iron deficiency anemia because of the lack of earning power to buy meat, to buy fish, and then the vegetables the children are running from. So you find that. And another problem, one of the symptoms we didn't talk about, which is relevant for children, is that iron deficiency anemia can also cause neural delays, neurological delays, and motor problems. You know, so you say, my child has a delay in walking, not strong, because we talked about oxygenation of all the cells. It involves the muscles, it involves even the bones, the movements. And then the brain. We talked about oxygenation of every cell of the body. That is one of the pathways in which iron deficiency anemia can affect children's both mental health and their neurological health. Talking about other causes, we also know that pregnancy can lead to iron deficiency anemia because the body is taking more. Yes, and you find that if you go regularly for your antenatal, you would always be given iron supplements throughout pregnancy and even up to 3 months postpartum. Incredibly, for me, while I was pregnant, I never had issues with iron deficiency anemia. And that was because I was always on iron supplements.
Oh, right.
So I didn't have that.
Okay, yes, no, they put me on, and I found out that I was constipated with one type.
Yes.
And the other gave me diarrhea.
Yes. So for me, I was always also constipated, but because of the baby in me, I would not compromise on that. What I would do is eat more veggies so that I would have loose stools and I'll be less constipated.
No, my anemia was actually quite bad because even aside from once I felt pregnant, it made it worse. I had people making me water.
So that you can take it. It's not that the month is adding
I don't even know why.
So that you can tolerate it.
It was. I could not. I think maybe my body didn't. The cellulose was too much or something. It just didn't work for me. So I just went back JJ to my tablets.
Pregnancy, yes, we talked about pregnancy, and then menstruation, because there's blood loss happening, and some women have very heavy periods. And so if you have very heavy periods, how do you know you are soaking up your pads maybe you're having to change up to 4 or 5 times a day? You're having to use menstrual cups and you're making more than 30 meals in 2-3 hours, or you have clumps that shows you that you have very heavy periods. In menstrual, in fact, it's been said that between women between 15 years of age to 49 years of age suffer from iron. Those who have very heavy periods, about 30% of anemia cases are found in women within this age group. Other things that cause anemia: blood loss, definitely blood loss from bleeding, any sort of bleeding, and that's where also the men come in. For the women, the menstruation makes it worse, pregnancy makes it worse, but any blood loss of any kind. And then we also have chronic diseases, things like chronic chronic kidney disease, because there is some in the process. There's the erythropoiesis. There's a red blood cell process in the kidney. So when you have chronic kidney disease,
when it's sort of helping clean out the...
No, not necessarily, but because of that process that happens in the kidney, it also affects the red blood cell production. There's that. And then also other conditions, infections like malaria also. There's that. HIV/AIDS is another thing. Then we have tuberculosis, and then we also have other diseases like peptic ulcer. Because of the lining. The lining that has been eroded, and also some blood loss.
Yes, because it's like a soap, essentially.
There's also malabsorption in the abdomen, and then we also have things like Crohn's disease or irritable bowel disease as well. There's that also. Those ones can also prevent absorption of nutrients in the body, which can lead to deficiencies. What else haven't talked about? We'll talk about some inherited illnesses such as thalassemias, and so we have the alpha and the beta thalassemias, and we have sickle cell disease, which is also quite common in our environment. In a nutshell, those are some of the causes of
what is, aside from the symptoms, so from the symptoms obviously we can get some of the physical effects that anemia is having on us, as women, for example. What of emotional, so from an emotional and mental.
Let's start with the children. So we talked about children, how it can affect them neurologically and their motor skills as well. So that's one. So we know that there is that effect. Then when we say as we grow older, mental state, if you are feeling tired all the time, if you don't feel up to yourself, there's something also that I forgot to mention. Restless leg syndrome. That is really bad, yes. In chronic anemia, restless leg syndrome is and it's worse when you are sleeping, when you are lying down, and it causes insomnia for some people and it's something I have experienced. Oh my goodness, I think for me it's the worst of it all, because you can't sleep. You always feel a need to move your legs, as if there is something inside you.
So what all people that are doing things like
so when you're on the bed, you just find that something has hooked you and you have to move your leg. It's not a good feeling. I experienced that. It's not a good feeling. That already would affect your mental health, and it will affect your ability to sleep. But beyond all of that, beyond the tiredness, the chest pain, the easy fatigue, all of these things also go on, because if our physical body is not at its utmost performing itself, it will also affect us psychologically.
I guess it's the stress involved with all the symptoms. I can't imagine if you're having to deal with all these things. There's no how it will not affect you from a mental perspective. Let's quickly touch on prevention and management, and we end it there.
All right. Prevention. How can you prevent? So when we look at the different things, we know that dietary causes are one of the major causes of iron deficiency anemia, and we've said that we should ensure that our meals have iron boosting elements to them.
Yeah.
Eating dark leafy green
Yeah.
vegetables, meat,
Yeah.
fish. They say lean meat, yes. Either red meat, at least to some degree.
Yeah.
Chicken, fish.
Liver. But it has a lot of iron.
We can, and then some fruits as well and vegetables. So you can just
And nuts.
do a nuts, like you said. So you can just research what food in your area, in your environment, have iron in them. And then for that, there's also sometimes some things that we see. There's this thing that they call koro. It's soba leaf. It's just
I
quite
just heard about that one.
environment. Yes. All you just need to do is boil it and you drink it, and if they say it boosts iron levels. Ugu leaves, like you said, dark leafy green. If it's to eat it, it's fine. If it is to
I would rather eat it as a salad.
yes. And but for some people, because when you squeeze the juice, so it's more concentrated. And then some people, then the adding of the milk or the malt is just to make it more palatable.
Yeah.
I forgot to mention one of the causes, cancer as well. Because I recall for management of cancers here in our environment, when they take their chemotherapy, we always recommend that they take ugu water because it really does help to boost the production of red blood cells. So that's that for prevention in terms of dietary causes.
Yeah.
Now for gynecological causes like pregnancies, we say we always encourage women at least 24 months apart from each pregnancy. At least. Ideally we say
if you're having those back-to-back pregnancies.
Yes, it puts you in danger of anemia and other problems.
Yes.
Then we also have, so for heavy bleeding, if you have heavy bleeding, endometriosis, see your gynecologist for management. And in the sense, fibroids come in here because a lot of them, depending on the site of the fibroid, they cause heavy bleedings as well. It's all still linked to menorrhagia.
Yeah.
So you see your gynecologist for that. And then blood loss. Let's avoid injuries or things that will cause blood loss. And as soon as we have them, let us treat to ensure that there is management of the blood loss so that it's less, and then it can reduce before you get to a point of examination. Hopefully not. Then what are the things that causes exercise, being fit? Well, it helps.
Yes.
It helps. But if you now have iron deficiency anemia and you are exercising, you will find that you are there. Yes, it happened to me because in the midst of that, there was a time during yoga, I passed out.
Yeah, so you can see now, because I'm looking at it now and I'm exhausted today. And it's a bit pale.
I'm taking supplements, so I'm taking my iron supplements. So
I think I need to, on that note, I need to go back and do my test to see.
Yes. So it's important. Remember,
how can you screen if you're not sure? What do you do next?
Don't self-diagnose, because like we said, there are different causes of anemia.
Yeah.
And so is in doing the test, you have to do your complete blood count analysis, and then they would know what if you have anemia. And then when you have anemia, they will then do further analysis of the type of anemia, because there's so many. There's some that are related to vitamin B deficiency. There's so many types, and so it's from knowing the type that you have that then the treatment. Because for me, by the time we did all my tests, I knew I needed to go back to my gynecologist, and I knew where the problem was. But I eventually had to just continue medication on taking hematinics and vitamin C. Hematinics, your blood boosting drugs like your folate.
Yeah.
I'm sorry, like your ferrous sulfate.
The medical lingo. Just
and then when you are giving hematinics, your ferrous whatever type, your doctor would also probably give you, because it helps with the absorption, and would also probably give you folic acid in case there is folate missing somewhere. Those are some of the things those are the key things that you do for inherited issues like thalassemias, like sickle cell anemia, management for them.
On that note, we have to say thank you so much to Dr. Anne for coming out to speak to us today. We're trying something out here. So if you've been following us, we normally do it at the IG Live, but today we decided that let's sit down in a more relaxed manner together and have a conversation about anemia. If this trends more, we'll be seeing more of us together. Thank you very much, everybody. Take care and God bless.